to talk to you guys about the pelvic floor and how it is actually a pressure system with your entire core. So I kind of like to think of it as a box to simplify it. The top of the box is your diaphragm, which of course helps us breathe, okay? The sides is your transverse abdominal muscles, which really kind of act like as a corset on your entire abdomen. The bottom is our pelvic floor, and the back is our spine, which is lined by the muscles, the multifidi. So when there's pressure put on the system and there's weakness in any area, there can be, those forces can go in that direction. For example, when we're pregnant or freshly postpartum, we do have some opening of our linea alba on the front of our abdomen here, so there's some separation. And if there's excessive pressure and we are not able to control that pressure, it may push outwards, and so we might see some bulging of the linea alba. So you might experience this when you sneeze, and there's a lot of pressure really fast, and that pushes that pressure down, causing us to maybe pee, have some pain. So why I want you to know this is the rehab that we're going to be doing this postpartum program or during our pregnancy is learning how to use the transverse abdominals to distribute that pressure and how to lift or engage our pelvic floor when appropriate. We work on a lot of breathing, which actually strengthens and relaxes the pelvic floor. So I said before, the pelvic floor is the bottom of that pressure system, and I kind of like to think of it as a bowl. That's a musculature that's holding all of our pelvic floor organs, like our bladder, uterus, up into the cavity there. So when we inhale, right, there's expansion or increased pressure, and that causes expansion of the pelvic floor, which is good, so that it's relaxing and elongating. Now, when we exhale, it naturally, calmly will recoil. Okay, so when we breathe, we're elongating with our inhale, shortening with our exhale, which is bringing range of motion and increased blood flow to our pelvic floor. So the videos in my program will show you how to incorporate your breathing, but when in doubt, you want to move with the exhale. So, for example, if you're picking something off the floor, lifting it off the floor, you want to exhale as you pull it off the floor. If you're pushing something overhead or putting it away in the cabinet and you feel some loosey-goosiness in your core here and you want to create more stability and protect your body, you're going to actually exhale as you extend and put it away. And that's going to, again, contract the pelvic floor, bring in your TA, and stabilize the system as you're completing a movement.